We had a high number of registrants for this program, but I do want to just kick it off and say thank you. For those of you I have not met, my name is Kaylin Risvold. I am President and CEO of the Naperville Area Chamber of Commerce. So incredibly excited about today's program. It's something that I have been working on with Edward-Elmhurst Health for a while, and I'm so thrilled that they're doing this program for you. I am a big believer in taking care of our whole self, and to take care of your business, you have to have something to give, and you have to be able to do that by filling yourself up. And I believe mental health is an incredibly important part of the scenario for us. So I'm thrilled that we're able to have a great discussion on mental health here this morning. I also want to thank our presenting sponsor, LifeStance Health. You're going to hear from Gretchen here in a few minutes, who's going to talk about that as well. They are longtime chamber members as well as Edward-Elmhurst Health. And I really think that hopefully the meetings like these and times like these, the stigma about talking about mental health is going away. We can talk about it openly, we can talk about it freely, of what we can do to support each other so that we are good employees, bosses, coworkers, friends, and humans. So I think this is the perfect timing. We're still in COVID, post-holiday slump, seasonal affective, and really there's never a bad time to talk about mental health. So I just wanted to give my personal thanks to Edward-Elmhurst for this, and to LifeStance Health for really sponsoring this so that this could be free to the whole community. This program is going to be recorded, so I just wanted to make sure that you all knew that. We're going to record this. We're going to put this up to make sure that other people can see this. I just think it's an incredibly important resource. So thank you to all of you. I'm going to pass it over to Lindsay Ewing, our Director of Programs and Events, to run this program. I just wanted to start with a sincere thank you.
Great. Thanks, Kaylin. Thank you all so much for joining today. We're so excited to have such a dynamic team here to talk about the importance of mental health and how to not only care for yourself, but for your employees as well. So if you have any questions as we go along, please feel free to just pop those in the chat and we'll get those addressed towards the end. And before we jump in, I do just want to give a huge thank you again to our sponsor for today, LifeStance Health. Gretchen Renfro, who is the Market Engagement Director at LifeStance, is here with us today, and she is going to say a few words. So Gretchen, the floor is yours.
Thank you. Well, good morning to all. And Kaylin, your words were so well said, so I echo your sentiments for certain, and really feel excited for everybody to be able to hear from Dr. Ryan and Dr. Vitro today on this important topic. I think you hit it, both of you, really right on the head, that we need more than ever to be caring for ourselves, to be able to care for those that we love and work with and for. So I'm excited. I know LifeStance Health is honored to be able to sponsor this programming because we obviously truly believe in it. So I just wanted to take just a few minutes to introduce LifeStance Health, which is formerly Edgewood Clinical Services. And that's probably the biggest point that I wanted to make sure that I shared with you this morning is really Edgewood Clinical Services has been in the Naperville area since 2013, I believe, and providing outpatient mental health services. We had 2 locations in Naperville, and we were in Plainfield and Lisle. And since we joined with LifeStance Health this past summer, we've just been able to go into a couple more communities in the Chicagoland area. And we really provide outpatient counseling for folks of all ages, psychiatry and psychological testing. And we do it both telehealth and in person in these unusual days. And just wanted to let you know, if we can ever be of support to any of you, the folks you work with or family members, we're really excited to be able to be a part of this community and provide those kinds of services like Edward-Elmhurst Care, Health as well. We currently have availability in all those services for immediate openings. So if anyone should need or is looking for those services, we appreciate that you consider us as part of those folks that are invested in this community and in people's mental health care. So with that, I wish you the best today in this programming. I hope you glean a lot for yourselves and also in the year to come. And I thank you to the Chamber very much for all that you do for Naperville and for letting us be a part of that mission. So have a great day, everyone, and thank you for the time.
Excellent. Thank you so much, Gretchen. And thank you again for your support. All right, so I'm going to quickly introduce our presenters for today. We've got Dr. Tom Vitro. He is an industrial and organizational psychologist, as well as the Vice President of Talent Management and Development at Edward-Elmhurst Health. And we also have Dr. Kelly Ryan, who is a clinical psychologist and the Director of Social Services and Doctoral Training at Linden. So I know you guys have a ton of great content to run through, so I'm just going to go ahead and turn it over to you and let you jump right in.
Thanks, Lindsay. Well, Dr. Ryan and I invite you to think about these slides in context of the various roles you play. We want you to think about this, of course, as some practical tips to care for yourself, but also many of you are mothers and fathers and significant others and family members. You have people outside of the workplace that you're caring for as well. And many of you are also leaders. And so we invite you to think about these slides and our discussion today in light of all of the different roles that you do play. Let's just take a pause here and reflect on the last 11 months or so. I mean, nobody ever said life will be easy, right? But the last year really has been especially volatile. We know that. And so all of this stuff that we're about to show you on the screen, just as a reminder, are things that happened in our very recent past. Obviously, we're dealing with a COVID-19 pandemic. And unfortunately, with 2021, it hasn't just gone away, mysteriously disappeared. It's still with us, and we're still feeling the effects of that. At the beginning of last year, there were tensions with Iran, and many people were concerned we were about to embark on, a significant conflict with the Middle East. There was stock market volatility. Murder hornets arrived in the United States. Lots of social injustice examples around the country. There were wildfires in the western states that were incredibly devastating. You might recall many federal agencies were hacked, exposing millions of pieces of data and lots of people to the bad guys out there. There were changes on the Supreme Court. There were riots recently at the Capitol. We had an administrative change. And of course, the backdrop of all of this is really where we began. We have significantly had to alter our lifestyles. Remote learning, remote working, masking up when we go to do something as simple and as mundane as going to the grocery store. It's a big production now. So yes, no one ever said life would be easy, but the last year really has truly rocked our lives. And frankly, it's really remarkable when you take a moment and reflect. This is going on all over the world. At work stressors often include these kinds of things. Right? So many of these might seem very relevant as well. And one thing that I haven't mentioned is, with all the things going on in the world and with all of our work stressors, we also have personal and family concerns outside of work that we're dealing with. Life is not easy, and the resulting psychological trauma of such stress is known by many names. Dr. Ryan is going to take us through that next.
Thanks, Tom. Yeah, let's go through some of these. Burnout, crisis fatigue, vicarious trauma, post-traumatic stress, second victim phenomenon, moral injury, compassion fatigue. All of these things can simply be defined as really distress. And this is caused by experiencing a trauma, a traumatic event, or due to repetitive empathic responses to the pain and suffering of others. So let's think about that. Repetitive empathic responses. So repeatedly having to put yourself into the shoes of other people who are also suffering. And it's often accompanied by the depletion of our physical, emotional, and spiritual energy, and really our capacity to care. Francois Mathieu did extensive research on this very topic. Francois is a secondary trauma specialist and educator in the area of burnout, self-care, and wellness. You can see a book she wrote over there on the left, among others. This is a great book. It talks about compassion fatigue. She also does some really great TED Talks if you want to check it out. And Francois identified really 10 symptoms of compassion fatigue. So let's go through some of these and maybe you can see if you've related to some of these over this past year. Physical exhaustion. Feeling exhausted even when I start my day, from the time I wake up in the morning. Insomnia or hypersomnia. Maybe you're oversleeping, or maybe having difficulty falling asleep or staying asleep. Trouble with sleep is one of the main things that I've heard from some of our staff in the hospital over this past year. This feeling of emotional exhaustion, feeling like I just have nothing left in my repertoire of emotional support to give to others. Addictions, having that extra glass of wine at night, then the next night it becomes 2, and the next day, maybe at 6 p.m., having another glass of wine because you don't feel so good from the glasses of wine the night before. Things like this can kind of creep up on us. It could be eating more than usual, shopping, online shopping now, more than usual. And things, you can really notice these things because they're things that you do in the short term just to make yourself feel better in the moment. And there might be long-term consequences, but noticing that you're really doing those things just for that sense of relief. Problems in personal relationships or distancing, maybe you're not there like you were before. Maybe when you're at home with your kids or your spouse, you're kind of checking out a little bit. Problems being present. Depression, feeling down. One of the main symptoms of depression is what's called anhedonia. Anhedonia refers to not being able to experience a sense of pleasure in things that you used to enjoy. It can also go into kind of under and oversleeping, loss of appetite, and things of that sort as well. Irritability. I've heard from so many people and experiences myself this past year, just being a little bit shorter than what we usually were. Feeling annoyed at that really happy-go-lucky coworker. And maybe just irritability and shortness with your spouse. Feelings of resentment. Feeling bitter about demands imposed on us by others. This could be higher-ups in our career, or it could be demands imposed on us by our kids or our spouse. Feeling a sense of professional helplessness. Maybe you used to have feelings that what you really did mattered. You were really doing something. And maybe that feeling's gone away a little bit. I'm just not making a difference like I used to, or I'm not feeling like I'm making a difference like I used to. And last but not least, a loss of hope. Feeling a sense of despair and that work or life is never going to improve. Things are never going to get better. So let's take a quick poll, and I'm wondering if we can kind of open up the chat box a little bit. Which of these symptoms, or maybe multiple symptoms, have you noticed yourself experiencing a little bit more in this past year? And if you have any, maybe just enter those right into the chat box, or if you'd like to say anything, you can also unmute yourself. All right, 100% compassion fatigue and emotional exhaustion. This is a great list, really relating to this list. Thank you. Physical exhaustion and resentment, depression and resentment, difficulty falling asleep, resentment and helplessness, emotional exhaustion. A lot of similarities. And you notice that it's not just that feeling within ourselves, but feelings towards others as well, and how we're interacting with others. Thank you. Now, let's flip it a little bit. Which of these have you noticed your employees experiencing in the past year? What has increased with employees, people you work with? Could even be just other people in your life. Anger, irritability, distancing, irritability, cynicism, turn off the news, LOL. That work will not improve, that foreshortened sense of the future, which is definitely a trauma response. Distancing, loss of hope, professional helplessness, lack of motivation, anger. If you're experiencing these things, the good news is you are not alone. To a certain extent, these symptoms are a normal consequence of working in any service-related field. But like Tom said, 2020 has been no normal year. All right, and I'm frozen, Tom. Are we able to click ahead a little bit? Can everybody hear me?
Yes.
Yes.
Sorry, I just experienced a slight delay.
No worries.
All right, just wait a second to get our PowerPoint back up here for a moment. So although these symptoms are normal and to be expected, the frequency and prevalence of symptoms and resulting maladaptive behaviors have increased dramatically this year. And what I'd like to do is share some of those statistics with you from our country as a whole and also in just DuPage County. The CDC estimates that 40% of US adults are now reporting anxiety and depressive disorders. In DuPage County, and that number is people who actually took their own lives. It doesn't represent the people who may have attempted to have taken their own lives. So you can see all of these things are really prevalent in our community. The good news is there are things that we can do for ourselves, for our teams, and our families to increase this sense of resiliency. Resiliency is our ability to bounce back in stressful times. So right now, I'd like to turn our focus onto learning about tools and resources that can help us and others build resilience and overcome some of these negative impacts before things progress too far. The most important way to combat crisis fatigue, compassion fatigue, burnout, whatever you call it, is to enhance resilience and this ability to bounce back. And this involves taking care of all facets of ourselves. So the 4 areas that we'll focus on are mental, physical, emotional, and spiritual. Let's review these quickly. Mental has to do with our ideas, thoughts, focus, and the way that we talk to ourselves. Physical, of course, is nutrition, exercise, sleep, and recovery. And I can't emphasize the importance of taking care of our physical well-being enough. When individuals come to Linden Oaks at any level of care, the first thing that we focus on is how are they sleeping and how are they eating? Because without these two things, you can't feel better mentally. Emotional. How are we doing in relationships? How are we experiencing our emotions? What is our ability to experience that optimism? And how are we focusing on our gratitude, things that we're thankful for? Spiritual has to do with our values, principles, and beliefs. And our values are really personal to each one of us. So I have no way of knowing what someone else's values are unless I would ask them. So the way that I often describe values are if you were your ideal self, how would you be acting in this situation? Whether it's at work, whether it's within your family, whether it's within relationships, whether it's related to exercise and your physical well-being. If you were the ideal you, how would you be? And when there's a discrepancy between our values and how we're acting, that's going to have a big impact on our mental well-being. So again, we need to focus on all of these areas because we're going to derive energy and resilience in our ability to bounce back by doing this. So let's take another quick poll. As you think about,
Kelly?
Yes.
Sorry, before we go on, one helpful idea might be to think of these 4 boxes as a wheel. Okay, so if you kind of smooth out the corners and think about mental, physical, emotional, and spiritual as parts of a pie, 4 quadrants of a pie. It's really important to think about where you're spending your energy, where you're expending your energy, and where you're needing to devote more attention. So when I work with leaders here, oftentimes we'll take stock of these 4 areas. And many of them will tell me, you know, I'm 100% on mental. I bring my whole mental game to work. I've got great ideas. I have a lot of focus. And it's when I leave work that I really don't care for these other things, the physical side of me, the emotional side of me, the spiritual side of me are really imbalanced. And if you think of this chart as more of a wheel, then the wheel needs balance in all of those areas to roll smoothly. And while that mental area is doing well, and maybe even you're in touch with your values and your principles and you're taking time for spirituality, but if your physical health is not being attended to, you're not getting enough sleep, you're not exercising, you're not eating the right things, if your relationships with other people are suffering, that wheel is going to kind of kerchunk as it's rolling around. And so one of the things that I think Dr. Ryan and I want to impress upon you is the importance of really living a balance across each of these 4 facets of ourselves.
Thank you, Tom. And I love that analogy of looking at it as a wheel. That's really powerful. And so we'd like to ask you all, as you think about these areas in your own life, which areas have been most challenging for you to care for? And Tom, I really love how you said, you know, maybe you're caring for a lot of these things at work, but not in your personal life. So I'm interested to see what people are seeing with that as well. So if you want to use the chat box, which areas have been most challenging? I see focus, absolutely. So that ability to stay present, and that is a very common trauma response, to have difficulty focusing in the moment, to kind of be off in your head. I see emotional, another mental focus, absolutely. Optimism has been hard, sure. The self-talk, how we speak to ourselves and our minds, and relationships, certainly. So
You know,
I see.
Michelle, I just wanted to comment on that self-talk. I'm glad you mentioned it because I have found in working with leaders throughout my career, especially those with very high standards, not just for themselves, but for other people, the self-talk that sometimes goes on in their heads is just remarkable. In other words, there are times that I think we say things to ourselves that we would never dream of sharing with another person. We would never think of saying the same things to a best friend or a family member or a coworker, and yet we do it to ourselves. And that's something we need to be more conscious of, and we need to go easier on ourselves sometimes and give ourselves the grace, just as we do with the people around us.
Thank you. Another comment, the mental and emotional have been hard. Given the news cycles in the past months, I feel like I have PTSD each morning, waking up to see what insanity came from the former president that day. I'm glad it's over, but will take me a long time to heal. And I think something that you said there is really important, and it's this idea of repetition. So trauma in itself can be really hard, but something that's happened over this past year is it seems to keep going and going and going. So whatever is stressful for you, it can be very important to kind of take those opportunities to unplug now and again. We're going to talk about that a little bit more on this next slide.
Hey, the one final thought on this is if you have difficulty with these 4 areas, you're not alone. It's very hard to lead a very balanced life. One trick, one tip that many resilient people have learned is they actually schedule time with themselves. They put these 4 quadrants on the calendar. And so they literally will make an appointment with themselves for 2 hours, for example, to do a physical or a spiritual or an emotional exercise. Blocking time off the calendar and then guarding it as sacrosanct is often a very helpful way to ensure that you're giving yourself permission and setting aside time to attend to each of these 4 very important areas.
I love that, Tom. And for anybody who practices mindfulness, that's really called this one mindfulness, right? That you're setting aside time to practice in all of these areas. We had a couple other comments in the chat box. Thank you for the insight on repetition. I noticed that recovery is in the physical category in this 4 square, but recovery is also important in the mental category. So true. And another comment, there seems to be no end to that repetition. Absolutely. So let's talk a little bit about that more right now. It's very important to spend time focusing on that which you can control. It's kind of funny. I have a 3-year-old and my daughter watches Frozen. So I've seen Frozen 2 about 50 times. And the wise troll says to Elsa, when one cannot see the future, one must just do the next right thing. And I was watching that one day and I thought, that's what we teach people. Disney might really have this together. Spend your time focusing on what you can control. In this year where everything has been so out of our control, there's this repetition where things keep happening. It's very important that we focus on what we can do. Lists really help with this. What can I control? Can I control this week? Now I'm going to break it down to today. And if I'm really not doing well, I'm going to write down what I can do in the next 10 minutes, and I'm going to actually check that off my list. What this gives us is a sense of something called self-efficacy. Self-efficacy is very important in your mental and emotional well-being because it gives you a sense of self-confidence in your ability to get through. So please, if you can, any chance that you get, make these lists and focus on what is within your control. Find activities that are calming, like reading, listening to music, or arts and crafts. And I think this really goes in to what Tom said about setting that time aside to focus on various aspects of your well-being. What's relaxing to someone else might not be relaxing to you. Some people love coloring in those little mandalas. I find that so frustrating. For me, what's relaxing is something that takes up more of my mental real estate, like a crossword puzzle, because then I don't have room in my mind to ruminate on things. Next, and this is very apparent, right? Limit our exposure to news reports. If you find it distressing that every morning when you wake up, there are all kinds of news report on your news app, you can delete your news app. You can take the notifications off of your news app. I stopped letting my phone feed me what news I get, and now I have apps for specific news stations that I've turned the notifications off on. So whenever I decide to set aside that time to be mindful of the news, for example, for a half an hour, I'm going to just focus on the news. But I'm not going to let it bing me all day. Bing, is that a word? Ding me all day in my phone, because I know that that's unhealthy to have that keep coming in all throughout the day. Reduce the amount of time spent on social media, very similar. Our social media apps are designed to keep us addicted in an unhealthy way. One program, one show on Netflix that addresses this is called The Social Dilemma. I highly recommend you watch it if you haven't, but it talks a lot about this and how these social media apps are really affecting our mental and emotional well-being. Something I've done personally is just turn the notifications off. Again, when I'm ready to sit down mindfully and spend a half an hour on Facebook, I will do that, but I don't need it coming in all day long. Spend more time with family and friends if possible. This has been especially hard this year. People have gotten really creative using things like Zoom and WebEx, or maybe FaceTime if you have an iPhone. We have found a creative way to use an iPad and actually project it onto our TV. So it feels like we're more present in the room with our family members that we aren't able to see right now. Something that's been really challenging for the younger generation, and I supervise a lot of young 20s, is that they text everything. And so those people are finding support from others. Unfortunately, it's through text. And text doesn't have the same effect on our emotional well-being as actually hearing someone's voice or seeing them. So I highly recommend, if you're able to, have that FaceTime with those that you love. Practice meditation, prayer, or yoga. These all can work spiritually, but they do something very important for us, and that's to bring us in to the present moment. These activities have actually been shown to strengthen what's called your prefrontal cortex. It's this front part of your brain, and that's your ability to reason and be able to control your emotions. So that's why a lot of people use apps like Calm and other meditation apps, because it actually can have a profound effect on your emotional well-being. And lastly, access support if you need it. We always tell our employees, you can be okay and you can still need support. Just because you're asking for support doesn't mean you're not okay. As a human being, you need that support. At Linden Oaks, we offer free confidential assessments. So if anybody's interested in reaching out to us, please give us a call. Today, we're also sponsored by LifeStance Health, and they also have openings right now. So please, if you need that support, reach out. And it doesn't mean that something's wrong with you, and it doesn't mean you know, that you have a mental illness or anything like that. It just means that you need support. Speaking of things that you can control, the National Institutes of Health put together this great emotional wellness checklist. The address is there at the bottom of the screen. I really love this because it is an actual checklist. And it gives you that sense of self-efficacy to check the boxes of things that you're working on, and those various aspects of wellness. There is a section for brightening your outlook, reducing stress, getting quality sleep. Again, this idea of being mindful and present, that's so important. Coping with loss and strengthening your social connections. And all of these are so important during this challenging time.
So
right,
go ahead, Kelly. Go ahead.
right now, it's so important that we care for our own mental well-being first. As the saying goes, put your own oxygen mask on first, right? If you don't take care of yourself first, you're not going to be able to care for those around you. And as leaders, we all have a very special and critical role in supporting the wellness, the mental wellness of our employees, not just employees, but I think our families and our friends and supports as well.
So Kelly and I are going to move into 3 areas for us as leaders that we can use, we can think about to enhance our employees' mental well-being. And the 3 areas are as follows: connection, communication, and gratitude. So let's start with connection. So as we all know, we're dealing with this pandemic, but we're also dealing with an epidemic. And that epidemic is of loneliness. We've heard this, it's worth repeating. Research, lots of research in this area, indicates that loneliness leads to not only physical, but mental health issues, morbidity, physical, mental, emotional disease, but also increased mortality. People can literally die from being lonely. And what this coronavirus pandemic has done is it's separated us. Even when we're together, we're socially distanced. But oftentimes we're not together, and we have loved ones who are in places that they're behind closed doors, unable to visit or be visited. It's a really serious concern. And connection is one of the most important needs of the human condition. Some would say it's even more important than food and shelter in some cases, social connection. So positive social relationships have really taken a hit in this COVID-19 world. There's a great article from April of 2006, I think, in the Harvard Business Review by Emma Seppala. She's a professor at the Yale School of Management. And the title is worth 1,000 words, right? Great bosses do more for wellness than wellness plans do. You've all heard the phrase, people don't leave their companies, they leave their bosses. Well, this article talks about the very simple but profound ways that a boss, a leader of people, can impact positively or negatively his or her employees' mental well-being. Connecting with other people really begins with acknowledging others. So often, especially when we're under stress and pressure, and this COVID-19 pandemic has created that for all of us, we forget to acknowledge those around us. We're really on autopilot, going through our days, going through our tasks, moving from one thing to the next, and we forget that we're living in a very social world. So connection, I just want to remind everybody, begins with acknowledging our fellow human beings. So how can we do that? Well, a smile goes a long way, right? Just smiling at someone can make a real difference in our own emotional and mental well-being. Frankly, it has a lot to do with our physical well-being. Smile and try to be unhappy. It's really hard, right? Now, masks have made it much more difficult. We can't see smiles as well as we can the other day, from days in the past. And yet there's some ways around it as well. Have you seen these masks? Or how about these? I've seen a few of these in the workplace as well. So there's ways to show you're smiling underneath your mask. I don't know if anyone's seen this, but I love these. This company actually takes a picture of your face, prints it to the lower portion of your face, and it becomes your mask. I mean, it's a little creepy, but it allows people to know what you look like. So how else can we acknowledge others? Lots of different ways. We can still grab a cup of coffee with one another. We can still wave hello behind our masks. We can do the elbow bump or the foot bump. Lots of different ways to acknowledge others. Let's see, what do we have in the chat here? What company makes these masks? You know, there are several. The one I saw was actually based in Paris, France. But if you Google face masks with smiles, you'll see a whole slew of different companies that make these very same masks. Other ways, why don't we take a moment and just ask you, how else are you and your employees going about acknowledging others? Feel free to jot a note or two in the chat box. Any other ideas? Team lunches, it's great. Obviously, socially distanced, 6 feet apart, we recommend. And yet team lunches, breaking bread is a very, very special thing to do with one another. Bi-weekly notes to all about accomplishments of individuals, another idea in the chat box. Great idea. So let's encourage not only ourselves, but our family members and our employees to acknowledge one another. Let's not do this. Still see too much of this going on, right? Obviously, this is pre-COVID. They're sitting less than 6 feet apart, fewer than 6 feet apart. But we see a lot of people walking through the halls, heads down on their phones. I mean, can we at least put our phone down, smile, nod? Let's nod each other into existence at minimum. Acknowledging one another is such an important part of humanity. You know, connection also refers to helping your employees remember, maybe get in touch with once again, your mission, your company's mission. This would be a great time at the start of a new year to pull a meeting together. It could be a Zoom call, just to reconnect people to your organization's mission. The reality is we all need to know that what we're doing matters and that our time and effort is making a difference. So getting people reconnected with your organization's vision, mission, values, very powerful way to build connection with your teams and your employees. Let's really make it a point as leaders to strive to make sure that every single person who works for us understands the difference that their job, their work on a day-to-day basis is making. Other ways we can connect with our employees, you know, we strive at Edward-Elmhurst Health to ensure that every leader has a one-on-one meeting with his or her employees. It can be virtual, it can be in person. It doesn't have to be weekly, it could be bi-weekly, it could be monthly, it could even be quarterly. But spending time one-on-one with each of your employees is a very, very positive and powerful way to build connection. Team meetings, again, can be virtual or in person, but we encourage you to get your teams together, especially now that many people are working from home and that interpersonal connection is missing from our workplaces. Having team meetings through Zoom or WebEx, even a phone call can be very, very powerful just to hear each other's voice. And if you can do it by video, seeing each other's faces is very powerful. And then we call it rounding. This is a fancy way of saying management by walking around. As leaders, we really do need to be visible. And if your employees are still in the workplace, I encourage you to make sure that they see you on a very regular basis. This is a brief, small picture here of our CEO, Mary Lou Mastro. She rounds every single day on various clinical floors. And it really lifts the spirits of our nurses and other clinicians who are caring for the most ill patients out there. Rounding and being visible is important. 2 final thoughts about connections. You know, you may want to establish a mental wellness buddy system at your place of employment. Just have people encourage each other, partner up with each other. Each person gets a partner and checks in. It's their job to check in on one another. Could be an email or a text, could be a phone call, could be stopping by a desk if you're at the workplace. But a positive word, a brief walk, a cup of coffee together can go a long way at helping the mental and physical well-being of our colleagues. The fact is, our minds, our spirits truly gain a lot of strength and resilience when we know that we have the support of others during difficult times. As a leader, don't be afraid to get personal. Show a sincere interest in the lives of your employees. You know, some leaders I know do a great job of jotting down birthdays, putting birthdays on calendars, putting information such as anniversaries or names of family members into their contacts, remembering important events in the lives of their employees. Very important to build that personal connection. Jot it down and make a point to get personal with your people. Let's move on to communication. Communication, of course, is not only about talking, it's also about listening. And I'd like to introduce you to a Chinese word. This is the symbol for the word listen in Chinese. You notice how complex this word is. Imagine yourself 6 years old in a classroom in Shanghai or Beijing, and your teacher says to you, okay, class, I want everybody to write down the word listen. This is what the kids have to do with their pens. Lots of strokes. Well, there's a reason for that. This word in Chinese, to listen, is made up of many different words. So let's unpack what ting, listening with ting, is all about. This first symbol is the symbol for the word ear. And beneath that is the symbol for the word king. So in Chinese, right, as you listen, the ear is king. Makes sense, nothing very profound so far, and there's much more. This is the symbol for the word mind, indicating the importance of listening with our minds. This is the symbol for the word I, indicating how important it is that we use our eyes when we listen to another person. We're looking for emotions. We're looking for body language. We're looking for facial expressions, maybe above the mask. And this is the symbol for the word heart. Listening with our heart, of course, involves listening with empathy, truly listening with our whole being. And when we do all of this, we are at one with the other person. So I encourage you to, when you listen to your employees, when you listen to your family members, your significant others, think about this framework and challenge yourself. Listen with ting. With your ears, yes, but your mind, your eyes, and your heart as well. More than ever before, our employees need us to listen. So Dr. Ryan is going to take us through a couple of other strategies for listening to our employees.
One idea I'd like to introduce you to is the idea of holding space. And this is really powerful listening, and it's the ultimate form of being there for someone else. If you're interested in this, this book by Heather Plett is hot off the press from this fall, and she really does a great job of describing how to hold space for another person. Heather describes it as being willing to walk alongside another person, whatever journey they're on, without judging them, without making them feel inadequate, without trying to fix them, without trying to impact the outcome. And the best way that I can get the idea of holding space across to you is if you can just take a moment and reflect on the last time you lost someone. It could have been a person or an animal that was really important to you. And I'm sure that you can probably remember things people said that didn't make you feel good. Well, at least this, or this too shall pass, or whatever it might have been that didn't necessarily make you feel good. And imagine the people that were most there for you and when you felt most supported. And what I hear most often from people is, you know, it was that person who just sat with me, that person who just sat in the pain, and they knew that they didn't have to say anything, and they knew that they didn't have to make it better. And what they did is they just sat. And that is holding space. Holding space is when you are 100% present with someone and you're just willing to share that space and that pain with them. And what happens when you hold space is you just take a little bit of that burden off of their shoulders and let it come onto their own, and you just sit with it and you don't try to fix it. Heather said when we hold space for another person or other people, we open our hearts, offer unconditional support, and let go of judgment and control. So the next time you get a chance to, I'd like you to consider the opportunity to hold space for that person. Another way to think about this is considering the opposite. The opposite of holding space is called conversational narcissism. And Dr. Derber, a sociologist from Boston College, came up with this idea. All right, so let's go through an example. Anne says, I'm swamped right now. Jim replies, me too. I haven't even had lunch. Another example. Anne says, I can't wait for my trip to Rome. Jim replies, oh, we went there last year. It was great. There's this great gelato place. Anne says, my mother has recently declined since the pandemic. Jim says, I know exactly how you're feeling. We had to put my mom in a nursing home about a year ago. All of these responses are called shift responses. What Jim has done, maybe not intentionally, is he's taken the focus off of Anne, who's expressing something, and shifted it back onto himself. Again, it's not something that we do intentionally, but shift responses don't feel good to other people. Instead, what we may focus on is something called support responses. Let's go over this again. Anne says, I'm swamped right now. Jim replies, ouch, what are you working on? Anne says, I can't wait for my trip to Rome. Jim replies, sounds wonderful. What's on your itinerary? Anne says, my mother's really declined since the pandemic started. Jim replies, I'm so sorry to hear that. What are you noticing that's different in her behavior? So I wonder if you can see the difference. When we use support responses instead of shift responses, others feel heard, valued, and cared for. And I think that's the ultimate goal, really, is not to turn the focus back onto ourselves, but to help that other person feel heard. Another resource, if you're interested, is a wonderful TED Talk by Celeste Headley on 10 ways to have a better conversation. Celeste is a radio journalist, author, and public speaker, and she does a really great job of describing how to be a better listener. So our challenge to you all over the next 48 hours is focus on support responses when you have the urge to do a shift response. You'll be amazed in how it changes your conversation.
No, I'd just like to add one thing here. Sometimes the shift response is given in an effort to connect or show empathy for the other person. That's our intent. But sometimes there's a difference between intent and impact. Our intent might be very positive here. We want the other person to know that I'm empathizing and I know how they're feeling, right? But the impact of that shift response is to hijack the conversation and instead turn the conversation back to ourselves. And so I do want to remind us that these shift responses aren't necessarily made with the intention of hurting the other person. It's very, very common. Start listening for this. It happens every day, oftentimes in conversations that we're a part of. People do it to us, we do it to other people. Don't be hard on yourself. If it happens, you'll notice it now. And then just pause and ask a question that re-engages the other and turns the focus back onto them. Okay?
Yes, thank you, Tom. And we got in the chat box, we call that listening to listen instead of listening to respond. Absolutely, thank you. Something important to consider is that the level of distress that you are under impacts your ability to be there and empathize and respond effectively to others. So some of these things that we're saying, you may already know, and in times of distress, it's good to remind ourselves. So let's look at some examples of active listening. Something you might consider as affirming. When someone's talking, saying, I see, interesting. Letting them know that you're following by those verbal responses. Clarifying. Help me to understand what you mean. And my favorite, tell me more about that. Nothing makes someone feel more listened to than when you say, tell me more about that. It offers them the opportunity to elaborate and to feel heard. Summarizing. So you're feeling ready to start working on this. Literally saying back to the person exactly what they just said in summary is going to help them to feel like you are really there and present for them. And reflecting whatever emotion it is that they might be feeling. I can tell you're upset. That must have been hard. And you must be relieved. Whatever it is, just reflecting back that emotional experience. And it doesn't mean that you need to fix it for them. So I guess the question might be on some people's minds is, why do I have to be doing all of this listening? I'm struggling too. Why can't people just do what they're supposed to do? Why can't people just be reasonable? Well, it's especially hard, like I said, when we're going through a hard time, and really especially hard when our emotions are high. So I don't know if you can remember the last time you felt like this volcano. I know I can remember the last time I felt like this volcano. How was your ability to reason when someone came up and talked to you and tried to go over the facts with you? Were you able to do that? Probably not. The reasoning area of our brain actually shuts down when our emotions are really high. Sometimes we just need to vent. Okay? So sometimes that front area of our brain, it's just shut down. We need to get the emotion out before we can come back and start processing the facts. Reflecting to someone is going to help return them to their reasonable mind. So this isn't just helpful at work. This can also help you with your spouse as well at home if they're really upset. Reflecting back, right, to get them to reason again. So let's go through a really easy to remember technique on how to reflect. It's called how, what, and why. All you have to remember is how, what, and why. You want to reflect back how they feel, about what, and why they're feeling that way. Let's go through some examples. I understand you're feeling upset because your pay was temporarily reduced. You're worried about paying the rent. I hear you're overwhelmed that COVID numbers are increasing and you're worried about how you're going to balance the stress of work, caring for your mom, and homeschooling. You're frustrated your hours were cut when other people were working a more regular schedule. You don't think that's fair. You'll notice in none of these responses am I trying to fix it for the other person. I can't fix a hard situation for someone else. But what I can do is I can help them emotionally by listening and reflecting back what they're saying. By doing that, I'm helping them to get the emotion out and help them to better be able to problem solve through their own issue. So again, remember how, what, and why when you're reflecting back to someone else. All right.
Let's move on to the third area, gratitude. We've covered connection, we've covered communication. Let's spend some time talking about the importance of gratitude on mental wellness. Being grateful has a very powerful effect on mental wellness. Lots of research here. Gratitude and the state of being grateful is associated with not only a positive emotional sense of wellness, but improved physical and mental health as well. It leads to resilience, it leads to greater happiness. There's a great study done in 2003 by a professor at UC Davis, Robert Emmons, and Michael McCullough at the University of Miami. And here's what they did. They asked participants to write down a few sentences each week. They divided the participants into 3 groups. So group 1, they asked them to write down the things that they were grateful for as they occurred during the week. Okay? The second group, they said, we want you to capture things that happen during the week that are irritating to you, things that displease you, things that get in the way of your getting your life done. And to group 3, they said, write anything. Just capture events that you participated in, events that affected you. And there was really no emphasis on whether those events were positive, neutral, or negative. And they learned something very interesting. After 10 weeks, okay, just a little over 2 months, the group who wrote about positive things that had happened to them during the week on a measure, an objective measure, were way more optimistic and felt better about their lives than people in group 2 and 3. They also found that these people exercised more and they went to their doctors less. The other 2 groups, particularly group 2, as you might imagine, had a much greater sense of negativity, anger, bitterness, because their words on paper were reinforcing all of the things that were displeasing to them. Another study by Dr. Marty Seligman of the University of Pennsylvania asked participants to write and then personally deliver a letter of thanks, a letter of gratitude to someone that had done something very special for them, but they had never actually taken the time to thank them for their kindness. And when participants did this, when they wrote the letter and they personally delivered it to that other person, they exhibited significant increases on scores of well-being and happiness. It lasted for well over a month. So this very act of just taking the time to thank another human being for their kindness is a very positive way of building gratefulness into our lives. So what can we as leaders do to make gratitude a part of the workplace? Well, first and foremost, we can be role models. Let's demonstrate our own gratefulness for the work that people are doing on behalf of our organizations. Look for opportunities to provide positive feedback about good performance to our team members, and be specific. You know, saying nice job with that is okay. And if you're more specific about what it is in that nice job that really made an impact, your feedback will be even more powerful. Here's an example of a way to show feedback using a model. This is called the CAR model. DDI has a model called the STAR model. Essentially, the STAR model is exactly the CAR model, except instead of C, which is providing context, the STAR model is provide a look at the situation and the task that the employee was engaged in. I think this is simpler. When you give feedback, spend some time telling the person specifically what you're giving feedback about. Give them the context. I just want to take a minute to thank you for what you did during this morning's staff meeting. Now all of a sudden that person has a very strong understanding of, okay, this is specifically what I'm being told thank you for or good job for. It's not just a general good job. Next is the action. Your offer to show Jasmine, in this case, how to run those reports and summarize the data for the upcoming presentation was excellent teamwork. Thank you. And then tell the person what the result of their action was. Hey, not only is she going to learn a great deal about our financial planning process and our software, you're going to help ensure our presentation to the senior team hits the mark next week. So thank you for that. I get asked a lot by leaders here, you know, why should I give feedback for good performance? My standards are high. I have high standards for myself. I have high standards for other people. When they meet my standards, they're just doing their job. So why do I have to go out of my way to give them feedback for good performance? There's lots of reasons. Okay, imagine working for a boss who only pointed out things that you could be doing better. Imagine how exhausting that can be after a while. You almost feel at some point as though there's nothing you can do to meet that person's expectations. The other thing that providing feedback for good performance does is it helps our employees know what it is they need to repeat, what it is they need to continue to do. So feedback for good performance needs to be as much a part of our repertoire as feedback for improvement. In fact, it really needs to be more than just as much. A Harvard Business Review article just a few years ago by Zenger and Folkman said essentially, we should strive as leaders to praise people 6 times for every time we criticize or give feedback for improvement. So think about that ratio, 6 to 1, and ask yourself, am I doing a good enough job sharing with people the things that they're doing well and commending them for the difference they're making? So what else can we do as leaders to enhance gratitude? Dr. Ryan, why don't you take over here?
Encourage our employees to be grateful towards one another. So this little flower is on a supervisor's door who works for me. Now, the door now has snowmen instead of an acorn and fall flowers, but that Post-it note is still up. One of her coworkers one day, and she's not even sure who it is, put this little flower on her door to brighten her day. And it meant so much to her that it's been up for 4 months. I think this really exemplifies how it's the little things that we do for one another to show our gratitude and gratefulness for them that really means something. It doesn't really have to cost us something. We don't always have to be buying lunch. It could be just a Post-it of, hey, here's a flower for you to brighten your day. Another idea is gratefulness letters. To write a gratefulness letter, you can think of someone who did something for you which you're extremely grateful for. Maybe someone you haven't thought about for a while. Write a letter addressing it to them directly and describe specifically what they did, why you're grateful to them, and how their behavior affected your life. Describe what you're doing in your life now and how you often remember their efforts. Then, if you want to take it a step further, tell them you'd like to see them and share something special, but don't tell them exactly what it is. It could be virtual. When you meet, say that you'd like to read your letter to them and ask that they simply listen. Take time to read your letter, and while you read, pay attention to their reaction and also your own reaction. After you've read the letter, be receptive to their reaction and discuss your feelings together. Give the letter to the person when you leave. Something that we did in our system here that's very similar to this is our transformation, they're called Transformation PX, Patient Experience. They emailed us all and asked us to do this. They asked us to write a card to someone who has impacted our career here at the organization and to express to them why they've impacted our career. And I did this for 2 separate people, and it meant so much to them. And it was a cool way for us all to just think of someone who was impactful in our lives, and then also reinforces those employees for doing a great job of being impactful to one another. So something to try. Another thing is encourage your team to identify 3 good things that have happened. It could be at the end of the shift, at the end of the week, at the end of the month, team meetings, whatever it might be. And then record them somewhere and celebrate and recognize people. This is a board on our mother-baby unit here at the hospital. So if you're wondering why number 2 is anybody who's had a newborn, you understand that that first poop is a very big idea. So they were celebrating that there on the door or on the board.
Hey, just one thing to add to the 3 good things. This is something that you can teach your kids if you have children. You can also do this yourself. At the end of the day, before you go to sleep, take a moment and reflect on your day. And rather than reflect on the irritations of the day, the things that went wrong, the things that you feel you could have done better, that self-talk, negative self-talk that we sometimes fall into, take some time and just write down 3 good things that happened to you that day. And let yourself fall asleep reflecting on why they were good things to you, what difference they made in your life, how they made you feel. And rest assured knowing that tomorrow is yet another day to have 3 more good things happen. Some people choose to journal a little bit about each of the 3 good things and write more than just a bullet point. These are the 3 things that happened, and that's fine as well. But keep it simple at first. And the only thing that Dr. Ryan and I would suggest is that you do this for 21 days. Do it for a month, and then notice how you're feeling at the end of the month. I think you'll find that this gratitude is very impactful to you personally and shifts your mindset from one of the difficulties that are pervasive in this world to feelings and thoughts of hope and optimism.
Absolutely. And 3 good things is a pretty popular topic. And so there are apps. This is a good app reminder for your phone, right? That to ding you at nighttime, but you can get apps that will remind you at night to put those 3 good things in. And there are also journals on Amazon with 3 good things. Team meeting gratitude exercise. I do this in my teams here at Linden Oaks. Start your meeting out with acknowledgments, asking, is there anybody who would like to acknowledge someone else on their team? Asking if there's anything that somebody else did that was awesome. And it's a way to really bring that to the forefront in the team, to say it in front of the boss. And I also put it in the minutes. So it's also reinforced when it goes out to them after the meeting, so that if people weren't there, they can still be acknowledged and see that they were acknowledged. All right, so to summarize, we've gone over 3 areas of focus for you all to enhance employee mental wellness. They are connection, communication, and gratitude. And with that, we can open it up to any questions you might have. Unless you have anything to add, Tom. Or comments?
Yeah, if anybody has any questions, feel free to pop those in the chat, or you can come off of mute and ask them. We'll just give it another minute or so.
Thank you, Margaret.
Okay, if there's no questions, I just want to thank you all so much for joining today. And of course, thank you so much to Dr. Tom Vitro and Dr. Kelly Ryan for this fantastic program and these really important and tangible takeaways. And also thank you again to LifeStance Health for your generous support of today's program. So thank you so much, everybody, and we'll see you soon.
Thank you for having us.
Thank you.